for placement of an external ventricular drain, this can be done in any care setting. And actually, frequently it's not done in the operating room setting because it's an emergency procedure. So this is a bedside procedure. We're going to use this cavity wipes to represent the child's head. The first thing that should actually already be sitting in the emergency department or the pediatric ICU is going to be our EVD cart. And on that cart should be an external ventricular drain and the cranial access set, as well as the Integra Bureautrol. This is the drainage system. So I would go to grab that cart, pull this off. This is the first thing we'll open. That's what this is. So on either a bedside table or a Mayo stand, if we're in the emergency department, I would make my sterile field. After I've identified where I want to make my burr hole access site for the baby and prepped everything out. So the child is prepped. With DuraPrep, we've injected this with some local, we've done our timeout. Now I'm ready to start the procedure. So this is what the cranial access kit looks like. This gets set down, I open this sterilely. I literally would be dressed the way I am right now. So that's the whole access kit. This is now a sterile field. So I need to put on my gown and my gloves. So set these separate. Same setup outside of the OR. And usually there's someone around that can at least tie up the top of it. That's all I really need. So, grab our gloves. Put them on. Okay, so now we're ready. So first thing we'll do after this kit is open is make our sterile field for the child. So this clear drape allows me to have visual access to the markers I need on the head for placement and at the same time maintain a sterile field. So this goes right over the child's head, right where we're planning to make our access point. Most of the time that's going to be right-sided. I also have a tendency, because there's usually a gap between the two, is to pull this as close as possible and then extend my sterile field by putting a white towel. I usually also get called while I'm doing this at the same time. So that extends my sterile field. Once that's done, we focus on what we need to do for access. So the first thing I do is grab, this is the hand drill that we use. I set the chuck up for the cranial access. I feel when I'm teaching this to residents, and I remind myself, it's very important to have a place for the sharps to go. So I have a tendency to grab one of these cups and use that for my sharps container. So I only need the largest bit for this, and I don't use the guard. All this goes there. I'm going to take the guard off. The chuck's going to go into the drill bit. This just needs to be nice and tight and secured. That's set. This set comes with a 15 and 11 blade, so I have the 15 blade set up. Usually around this point I'll ask for some saline. We'll put saline in a cup. That's how we're going to clean things up and irrigate out the catheter if we need to. And then the next thing I'm going to ask for is actually the catheter. So this, now that I'm sterile, I need the assistance of everyone else. So I'll ask for the external ventricular drain to be opened up for us.
Show me how you check your expression.
So make sure you have the right catheter. So it's the Codman EVD catheter. And on the bag box, it also has your expiration date to make sure that we're not expired before you hand it off. Everything inside the bag is sterile, so you have to open it in a sterile fashion.
So I'll grab the catheter. So sometimes if I'm really in a rush and there's no one around, I will actually omit that step by opening, as soon as I've made the sterile environment, opening and dumping the catheter on as well. Occasionally the catheter slides off. That's not very much fun. You just gotta get another one. So now we're set up actually to do our access. The first thing we do is I'll take some of those 4x4s we have. There's gonna be a little bit of bleeding. We'll have injected our local, take my 15 blade, make our scalp incision, right? I'm holding the bleeding. That incision goes all the way down to the bone. It's gotta be wide enough that I can put this drill bit in place. Knife goes back safely. Now I take the drill bit, separate this away. Need the assistance of someone to hold the chin of the child. Great, and from this, I'm gonna actually brace myself, start my drill for the access burr hole. Burr hole's made, come back, take this out. Now I'm going to need to use my 11 blade because I've got to open the dura, right? So all I've done is make a hole in the bone, cruciate opening for the dura, so one incision this way and one incision that way. Now I'm ready to put the ventricular catheter in place. So you open the catheter. That shouldn't happen. If it does, that's a problem.
Very important piece.
But it's good, real world, right? So we just have to get another red towel. So here's the catheter, right? I've got my access burr hole. You'll see us looking to see where the tragus of the ear is, where the medial canthus is of the eye. We line those points up. The confluence of that puts you perpendicular to the brain. You advance the catheter slowly. Around 5 centimeters, I should get a loss of resistance and CSF coming out. Once that's done, stylet comes out, confirm that we have good CSF flow. Then you're going to see me compress this, right? And then the next thing we need to do is tunnel this. So we use this trocar here for tunneling. This gets tunneled into position. We attach this to the end. Now I can pull it through the scalp. That gives us infection resistance. And then the next thing we're going to need is the Barrett-12 drainage system. So we're going to pretend like this is already tunneled.
So here is the system. Again, you always check to make sure your expiration date, and that is on the bottom. So we're good for December 2022. Inside the box, there is the green tie system. This needs to go to the nurse. Don't lose that, otherwise you'll need to open a new box.
That's for leveling.
And then the bag. Again, this is all sterile. You open this up in a sterile fashion.
Okay. We grab the whole system. It's kind of ungangling, you know. There's no other way to really make this. The other thing I like to do is have a trash can that's sitting nearby, so things like that we just toss right away. And so now this becomes a 2-person portion of care. And the reason why is I no longer need this, so I can hand this off to the nurse. I need to, or the PA that's helping me, I need to keep this side of the system sterile, however, because this is where we're going to connect. Every system is a little bit different. It does usually pop it open, yeah. Everybody's different. So now we have access to our drainage system. And the next thing I do is really kind of unique to me. Because when the tube is empty, right, there's obviously increased surface resistance. I usually will access the system more proximally, right? So we'll turn this off to drainage to the bag, remove this cap, and then remember the saline I asked for before? I'm going to draw that up in a syringe and place this syringe onto this outlet. That's going to allow me to pressurize the system so I have a nice fluid-fluid interface. So you know there's CSF coming out here, now there's going to be normal saline. We connect these two things together, and now we have a complete system of low resistance. Right? Once that's done, flip this to off. I maintain secure control of this, put it back in place, and then we can test to make sure that the system is draining by lowering it. We also raise it up to make sure it runs back into the brain, so it's a fully fluid coupled system. And then we actually will actually clamp the system. That's it. That
Will you
completes
have the nurse do any of the parts on the drainage bag, or will you do that all?
I could talk the nurse through doing it. That's helpful if they're able to do that.
Okay.
If not, then as long as I have the saline, there's a syringe in the set. I can
And
do
you've
that.
maintained sterility, and
Yes.
that section of the kit has not been touched.
Correct. So the only portion that's touched is the top.
That's why I kept my hand here and just kind of give you teaching to push it in.
Access to things. Yeah.
Okay.
So once that's done, now this is all connected up. We're draining spinal fluid. We can measure ICP, but I've got to actually put a strain relief on this so the kid doesn't pull it out. So we'll curl the tube, and this is why it's important to have an external ventricular drain. That extra length is what allows us to do this strain relief. So there's going to be a strain relief. There's suture that comes in the set.
This is also in the box.
Yep. So same thing, you can't just open that bag and dump it in. It's actually got to be opened sterilely.
Again, I would double check all of the expiration dates on the packages.
Your expiration date is signified by your hourglass shape.
So I grab this. There's a needle driver that's already built into the set as well. It's the Sharps for Sharps control. We'll put that here. So I grab my needle driver.
That's why there needs to be a trash can so you can
Yep. I normally get rid of all this.
throw all this stuff away.
Grab my needle driver. I'm going to secure the ventricular catheter with a strain relief to the scalp, Roman sandal style, as well as close the incision that the scalp incision I used to make the access. And then we apply the micro. The one thing we do need is that same microbial dot that we use for central venous catheters.
Cardiva
Alphadex or
Yes.
Cardiva.
pack.
Disc of life.
So I put one of those right where it exits the scalp, and then we put Tegaderm over the top, and that's the end of it.
All right, thank you.
Of course. Thank you.